Uh, recording on therapy. Okay. We will start today by talking about surviving the loss, the grieving process. The learning objectives mainly are how do people experience the grief process? What feelings do grieving people have? What is the difference between normal and abnormal grief? And then we'll be talking more about the various stages of life. So the grief process is different in different situations. Some people have grief process differently expressed, like the young people express their grief differently, the middle-aged people express their grief differently, and the old people express their grief differently. So what is the difference in the presentation of all the people who are having the grief at a various ages of life? So if a child loses somebody, what will be his reaction, and how you will be able to understand that this is a grief or an abnormal grief? And then if an adult loses someone, what is that presentation? And if an old age person loses someone, what is their presentation? It's not necessary that every time people will say that I am having grief because I lost somebody. Well, in majority of the situation, if you are taking a good history, you are able to understand it. But in some situation, it is usually difficult. So when we talk about the grieving process, bereavement is the state or condition caused by loss through death. Grief is the sorrow, hurt, anger, guilt, confusion, and other feelings that arise after suffering a loss. Mourning is the way in which we express our grief. Mourning rituals can be fairly standard across a culture, so grief varies greatly. So, like in Muslim religion, when somebody dies, we have multiple ritualistic situations. So, it depend करता है कि आप किस फिके से ताल्लुक रखते हैं, लेकिन लोग तीसरा मनाते हैं, चौथा मनाते हैं, जुमेरातें मनाते हैं और फिर 40वां मनाते हैं। और कुछ फिकों में इसका कॉन्सेप्ट नहीं है, कुछ फिकों में है। सो रिचुअलिस्टिक बिहेवियर जो भी हो doesn't makes a difference in the presentation of a grieving person. So if somebody is grieving, आप दूसरा मनाएं, तीसरा मनाएं, जुमेरातें मनाएं, 40वां मनाएं, grieving process जो है stays fairly the same, or it varies from person to person. But all these ritualistic behavior that definitely contributes something in the grief process, positive or negative. Most of the time it's a positive, because whenever you celebrate or do this kind of rituals, there is a gathering of the people around. So हर जुमेरात को अगर आप फातिहा खानी करवा रहे हैं, तो होगा ये कि लोग आएंगे and they will gather in the house and the family, and then they mourn about the person, with the person who's grieving, and mourn with them and share thoughts and feelings with them. Now, when they try to share thoughts and feelings and emotions, things do get better sometimes. Sometimes they won't. So, that is one of the things that is essential. Okay, now, when the grieving process begins, people must do several things during the grief. So, this is a standard that we recommend to most of the people around, that this is what you have to do. I'm sorry, there is some sound. So, if all the participants can mute their mics, it will be better, just to be on the safe side. Okay. So, people must do several things during the grief. One, acknowledge the reality of loss. So some people feel that they have the symptoms, but they are not grieving because they don't feel that they miss the lost person. That is unfortunately the problem. So whosoever is grieving, he should acknowledge the reality of the loss, that yes, that person is gone. Work through the emotional turmoil, and whatever your emotional feelings or gestures are, you have to work through it. how to overcome it. Only then the grieving process will settle down. Adjust to the environment where the deceased is absent. Loosen the ties to the deceased. It is important to remember that grief is a process. We must avoid several mistakes. Like, grief is an individual process. No two people grieve exactly the same. Two, we must not underestimate the length of the time people need to deal with the various issues. 1 year is needed and 2 years may be required. So हमारे यहाँ एबनॉर्मल ग्रीफ 6 वीक से ज्यादा टाइम गुजर जाए और ग्रीविंग प्रोसेस सेटल डाउन ना हो तो हम कहते हैं कि एबनॉर्मल ग्रीफ रिपोर्ट किया जाए बट देर आर वेरिएशन सो people may take little bit longer period of time than 6 weeks, or maybe they can go up to a year, maybe 2 years as well. And every time there is a death anniversary, the grief comes back with the same intensity and severity for at least 1 or 2 years' time, and then the severity reduces. This is unfortunately tricky, but kisi jagah pe, if you people are not able to understand, just let me know, and I will try to make you people explain you more. Okay, एक छोटी सी ये कथा कह लें या गजल कह लें, बट छोटी सी है. ये मोहब्बतें, ये इनायतें, ये मुसर्रतें तेरे नाम हैं. सो अ ग्रीविंग पर्सन मे से दिस. मेरे हम कदम, मेरे हम नशी, ये रफाकतें तेरे नाम हैं. कभी गुमशदा, कभी रूबरू, कभी आईना, कभी अक्स तू. मेरे हम नवा, मेरी ख्वाहिशें, मेरी सोहबतें तेरे नाम हैं. कभी ये हंसी, कभी ये नमी, कभी ये रंजिशें, कभी कुर्बतें. मेरी जिंदगी की हंसी सुबह, ये इबारतें तेरे नाम हैं. A grieving person can pass through multiple situations. Now, what are the risks involved in the grief? So, if somebody is grieving, then we have to understand the dynamics of his social contents, his psychological factors, his personality factors, his past psychiatric morbidity, and so on, so other things. So there are certain factors which may be risky. Mode of death affects the grief process. So if there is a sudden death, then obviously grief will be very intense and severe. But if a person, a family member, is sick for a long period of time, the lengthier the illness, the overcoming with the grief is relatively better. Well, it could be variable, but mostly it is like that. When death is anticipated, people experience anticipatory grief that allows for working through some of the issues ahead of time. So when you know that somebody is sick, he is going away, doctor has declared that he won't last for more than a month or 2 months or 6 months, then you start preparing yourself. So the grief process is relatively different than what the grief process is when somebody dies suddenly. The strength of attachment to the deceased makes a difference in the amount of time and difficulty of the grief process. So if you are very much attached, the grief will be more intense. If your psychological dependence, your social dependence, your financial dependence is intense with the dying person, the grief is definitely complicated. But if you're not too much attached, like if you are not very much associated with your father or mother who were living in Pakistan and I'm living in Canada, I haven't seen them for maybe couple of years, 2 years, 3 years, then maybe that grief will be different than the time when I'm living with my parents and they are in front of me. Two risk factors have been researched: lack of social support and kinship. So people who have too many brothers and sisters, which is a good thing in Pakistan, of course, every family has about 3, 4, 5, 6 siblings. So usually that makes things different. But if somebody is alone, or mainly there are only 2 children, a daughter and a son, or two sons or two daughters, then the grief would be different. So you have to understand that all these factors have their impact on the grief. Grief over time. Rosenblatt reports that people still feel the effects of deaths of a family members 50 years after the event. So my father passed away back in 1995. I can still feel the grief and intensity of the pain by missing him. The length of time did not diminish the depth of emotions experienced. Religiosity has been investigated as a source of support for people following the loss of a loved one. The results are mixed as to whether this factor provides help or not. So, religious factors like I will do chaliswa, I will do barsi, I will make sure that I try to invest money on other people religiously. So, some sawab goes to my parents. Whether this helps in actually the psychological process of the grief or not, it is there are studies quoting different ways of going through it. Coping with the griefs, two processes have been proposed to explain the grief. The four component model list. Now, four component model lists is the context of the loss. Kis tarah death hui. The continuation of subjective meaning associated with the loss. मैं कितना उस शख्स के साथ ताल्लुक वास्ता रखता था. The changing representations of the loss relationship over the period of time. So when I was child, I was close to my mom. When I grew up, I was close to my father. When I was in the middle age, I was more close to my mom. And at 50s, I was more close to my father. So those things vary as well. So when you are trying to assess a person passing through a grief time, these representations are important. The role of coping and emotional regulation process. How strong I am with my emotions, expressing them or hiding them. Expressing emotions is a better option. So if you are angry, you express your anger in a nice way, of course, not in a way that you hit people and shout and do other stuff, but expressing your emotions and regulating it according to the acceptable norms is a better option to express the grief as well. Now, the second process is the dual process model of coping with the bereavement, which is called DPM, lists two types of stressors. One, loss oriented stressors, those having to do with the loss itself. Restoration oriented stressors, those related to adapting to the survivor's new life situation. So I won't be seeing them again. So I am living without them. That concept of living without them can be different in different scenarios, right? Okay. Moving forward, now this is the dual process model of coping with the bereavement. It shows the relations between dealing with the stresses of life, loss itself, loss oriented, and moving on with the one's life, restoration oriented. Now, if you see this diagram, the arrow is very staggering from one side to another. Okay, can you see yourselves, whosoever has joined recently? Thank you. Okay, so loss oriented, restoration oriented, grief work, attending to life changes, intrusion of grief, doing new things, breaking bonds, ties, relocation of the deceased person, distraction from grief, denial, avoidance of grief, denial, avoidance of restoration changes, new roles, identities, and relationships. Now, I always try to express the way I coped with it, but because this is another way of better understanding. So I give you my own example. When my father passed away, I was in my department. I am very thankful to Allah Jannat Naseeb Kare, my mentor, who was so kind enough कि वो मुझे डिपार्टमेंट से लेके एयरपोर्ट गए, उन्होंने मुझे पैसे दिए, जहाज पे बिठाया और उनका एक वहाँ पे जानने वाला मिल गया. उसको उन्होंने कहा कि इसके वालिद की डेथ हो गई है तो इसको घर तक छोड़ दीजिएगा, और वो साहब मुझे एयरपोर्ट से घर तक छोड़ के भी गए. Although he was very much against छुट्टी, so उनसे छुट्टी मांगना ऐसे ही था कि जैसे मैं FCPS का इम्तिहान पास कर लूं. लेकिन during that process, his one gesture of taking me from department to the airport and then making me go to my father's place, I will never ever forget it, right? And then after I came back, मेरे बीवी बच्चे पीछे रह गए और मैं वापस आ गया काम के ऊपर, लेकिन मैं काम पे नहीं गया और मैं 3 दिन और 3 रातें सिर्फ घर में बंद रहा, बेड पे लेटा रहा, सोता रहा, लेटा रहा, सोता रहा, कुछ खाया नहीं, कुछ पिया नहीं, उठा पानी पिया, सो गया. घर में खाने को कुछ नहीं था. So I remember I was alone and I spent 3 days and 3 nights there. But after that, I just thought about it and started doing work and going back to the job. So restoration oriented, attending to life changes, doing new things, distraction from grief, denial and avoidance of grief to overcome that, new roles, identities, and relationships. So, how much I should be attached to my son, how much I should be attached to the people who are still existing and living with me, that gives you more meaningful things. So, when you are doing a grief work, you have to keep a focus on all of these things. Now, normal grief reactions, there are hordes of grief reactions which are expressed in the literature. So, people express their grief, which is normal in every aspect. So, from simple anxiety to over talking to absolute avoidance to getting psychotic, whole range of things are there in grief, and they are all considered to be normal. They are all considered to be normal. कहीं पे abnormality का जिक्र नहीं आता. So coming to the terms with the bereavement is called the grief work. So we have to make sure that we make the person understand that this is the grief work. You have to do this, and this to overcome the grief. Grief work consists of coping, affect the again your mood symptoms, the change whatever was existing, acknowledging that, and the relationship. Many people experience anniversary reactions, which are changes in behavior related to feelings of sadness on the date of the loss, which is again one way of looking the things. कोई आ रहा है जा रहा है या something is happening? Okay, I'm sorry. बेनजीर, इतना sad face क्यों बना रही है? Okay, I did. I still
स्टोरी
cannot
सुन रही
see
थी
the
आपकी.
screen. So if you are not able to see the screen, I think you should leave back and come back again. And even then, if that won't work, अगर आप मोबाइल फोन पे हैं तो उसकी स्क्रीन को मूव करें, आपको स्क्रीन नजर आ जाएगी. So sometimes it is on the other page of the screen. So move the screen and you will get it. Traumatic grief reactions. Traumatic grief involves symptoms of separation, distress, preoccupation with the disease to the point that it interferes with everyday functions, symptoms of traumatic distress, mistrust, anger, and detachment from others. Now, traumatic grief reactions, when somebody dies in an accident situation, is different from a normal other grief reaction when somebody is sick and dies away. So all grief presentations needs to be assessed in a separate way. All the grief reactions cannot be assessed in a simple paradigm कि ये बस सवाल 1 2 3 4 पूछेंगे, हाँ जी फलां की डेथ हो गई थी, घर में फादर की डेथ हो गई थी, उसके बाद से ये अपसेट हो गया. So हमें उस, if we have to really understand whole of the situation, then we have to understand whole of the dynamics as well. So dying and bereavement experiences across the lifespan. So बच्चे के रिएक्शन क्या होंगे, मिडिल एज के क्या होंगे, मेरी उम्र के रिएक्शंस क्या होंगे, ओल्ड एज के रिएक्शंस क्या होंगे. So all everybody presents with a different presentation. What do children understand about death? How should adults help them deal with it? How do adolescents deal with death? How do adults deal with death? What are the special issues they face concerning the death of a child or a parent? How do older adults face the loss of a child, grandchild, or a partner? So that is different. Every lifespan has a different presentation of the grief. Childhood. Three major areas of developmental change affect a child's understanding of death and grief. One, cognitive language ability. Two, psychosocial development. Three, the coping skills. The ability to cope is more limited in children. Methods may include regression, guilt for causing the death, denial, displacement, and other psychological processes. And all of these presentations, again, I'm sorry, I won't be going into the detailed explanations of most of them because it will be lengthy, but I will try to cover up it as much as possible. वासिफ अली वासिफ साहब कहते हैं, तेरा बंदा वासिफ बेखबर, तेरा राज समझा है इस कदर, तुझे जब पुकारा अब्र चश्म तर, कई मरहले थे जो टल गए. So obviously, being associated with religion, we have certain faith and backgrounds which may help in overcoming the grief. But as I told you, the literature is variable. And it's variable because everybody's faith is variable too. So some people are very strong in their faith, some are mild faith, some are moderate faith, so etc. So it varies. So in childhood, bereavement in childhood usually does not have long-lasting effects, such as depression if the child gets adequate care. So if a child loses a father or a mother, then they won't last, the grief won't last long if they are supported well. A child may have difficulty with the concept of death if adults are not open and honest with them. So हम कोशिश करते हैं बच्चों से छुपाएं, इनको ना बताएं कि जी तुम्हारी वालदा की डेथ हो गई है, तुम्हारे बाप की डेथ हो गई है, तुम्हारे भाई की डेथ हो गई है, तुम्हारे बहन की डेथ हो गई है. We try to hide it, which is unfortunately complicated and it makes things more complicated, right? So you have to be careful that children, the good part is the children are able to get over with the grief process earlier than what we expect if we are in an appropriate way. Screen nazar nahi aa rahi. Can anyone see the screen? Yes, yes, no, I can. Okay. If people are not able to see the screen and some people are able to see the screen, it means the problem is at your end. So you have to do something about it. If my screen is not seen by most of the people or all of you, then the problem is at my end. So I will try to do that. I'm going back again to the slide. I'm sorry. Adolescents have more experience with death. 50% of the college students have experienced the loss of a family member or a friend in past 2 years. जब आप बच्चे होते हैं तो chances of losing someone is relatively less. मेरे एक दोस्त साहब मुझे अक्सर ये कहते हैं, मुझसे थोड़े से उम्र में बड़े माशाल्लाह हाफिज कुरान हैं. He's a wonderful person and he always says that as you grow older, when you are younger, you always hear good news. When you are adult, you hear good news. फलां की शादी हो गई, फलां के बच्चा हो गया, फलां ने जो है वो MBBS कर लिया, उसने FCPS कर लिया, उसने MRC साइड कर लिया, MRCP कर लिया, etc. But as you grow older, you hear bad news mostly. Because उसकी डेथ हो गई, वो मर गया, वो चला गया, उसने उसको छोड़ दिया, उसकी तलाक हो गई. I don't know whether it's true or not, but yes, by the time you are adolescence means between the ages of 14 and 20, then you do have experienced something related to death, some loss in the family. So नाना की, नानी की, दादा की, दादी की, किसी की death हुई और आपको वो experience हो गया. So adolescents are usually exposed to death experiences. Young adolescents are reluctant to express or discuss their grief, and they may be more likely to experience psychosomatic symptoms. Now, when we were talking about the children, we know that the children are able to cope up with the grief very soon if they are supported well. But adolescents have difficulty in expressing their grief and they end up having depressive and other symptoms. So most of the people that you will be seeing in your clinical settings, they will be between the ages of 14 to 20 who are having complicated grief mostly. Adolescents who lose a parent may show many similar behaviors to those who have lost a sibling. So this is again complicated. When you grow adult, young adults express a sense that those who die at this point are cheated out of their future. क्या ये मेरे साथ ही होना था? ये सारा कुछ मुझे ही भुगतना है, ये सारा कुछ मेरे ऊपर ही मसले आने हैं, ये सारा कुछ मेरी साथ ही परेशानियां होनी हैं. So in adulthood, between the ages of 20 and 45, you have different experiences and you react relatively more as well. So loss of a partner in a young adulthood is very difficult, partly because the loss is so unexpected at the time. Losing a spouse in middle adulthood results in challenging basic assumptions about self, relationship, and life options. Loss in middle adulthood may result in shifting of thinking of how long they have lived to how much time they have left. So आप फिर गिनना शुरू कर देते हैं. So जो mid adulthood की बात कर रहा हूँ, between the ages of 20 and 45, when you loses someone, the reactions are intense and severe, and it could be very negative. So that is the most crucial. So एक adolescence का time crucial था और एक mid adult का time crucial है क्योंकि reactions intense हैं. Death of one's child in young and middle adulthood. Mourning is always intense and some never reconcile the loss. Young parents who lose a child to any kind of, again, thing are more negative to view of the world and guilt. A parent's attachment to the child begins before the birth, and loss of a child during childbirth can be very traumatic. People are expected by society to recover completely from such an experience. So, कोई बात नहीं, बच्चा मर गया, पैदा हुआ था, पैदा होते ही मर गया, कोई बात नहीं, और पैदा कर लेना. Now that middlehood life, when you are 25 to 30 and you lose a child during the childbirth, a woman loses a child during the childbirth, is very traumatic. And one of the reasons why I'm always asking the gynecologists to learn psychiatry is that because their concept of psychiatry is unfortunately very compromised. So I don't know, this may be my experience, I haven't done any study on it, but most of the gynecologists, they take it very lightly. So बच्चे की डेथ हो गई पैदाइश के दौरान, खैर है, बच्चा की डेथ हो गई, कोई बात नहीं, और हो जाएगा. But the woman who is having that loss probably won't be able to understand in these simple words that usually the gynecologists say. Death of one's parent. When a parent dies, the loss hurts, but also causes the loss of a buffer between ourselves and death. We may feel that we are now next in line. Death of a parent may result in a loss of a source of guidance, support, and advice. So I always say कि जब आपका बाप चला जाता है तो आपको लगता है आपके सर पर से छत उतर गई, और जब आपकी माँ चली जाती है, माँ बाप दोनों चले जाते हैं, तो आपको ऐसा लगता है कि आप बरहना हो गए, नंगे हो गए, और आप बेयारो मददगार हो गए. And this is again a normal human expression of a loss of a parent. The loss of a parent may result in complex emotions, including relief, guilt, and a feeling of freedom as well. Now, this is very complicated. At one end, I am an adult. I lost my parents, and I can feel that now I am guilty because I never did anything for my parents. और इस थीम को लेके कि मैंने अपने माँ बाप के लिए कुछ ना किया, उसकी intensity, it varies as well, right? So if my father needed the money, why I was not there to give him the money? Now I have the money, I should have given that to my father. So that kind of a thing. And on the other hand, it's a freedom because you are an adult, you are a grown-up man. Now you have other responsibilities to look after. So you are playing the role of a father. So it's very complicated. And this psychological process can lead to multiple complications. Late adulthood. Older adults are often less anxious about death and more accepting of it. So जब आप 45 से 50s में चले जाते हैं, 60s में आ जाते हैं, 60s के बाद का टाइम पीरियड होता है, तो डेथ के मीनिंग डिफरेंट हो जाते हैं. So the acceptance is more. So both the extremes of ages, the young children and the adults. Adults means people with around the age of 50, 60, 70. The acceptance of death is relatively better as compared to the middle ages, which I have discussed, adolescence and middle ages of the adulthood. Elders may feel that their most important life tasks have been completed. Older adults are more likely to have experienced loss before. Death of one's child or grandchild in late life. Older bereaved parents may have guilt that the pain of a loss of a child affected the relationship with surviving children. Many grieving parents report that the relationship with the deceased child was the closest they ever had. Bereaved grandparents tend to hide their grief behavior in an attempt to shield the grieving parents from the level of the grief being felt. सो उधर एक जिम्मेदारी बन जाती है कि मुझे स्ट्रांग होना है ताकि मेरे बच्चे और उनके बच्चे कंफर्टेबल रहें कि बाबा जी या बुजुर्ग या अम्मा जी जो हैं वो अपसेट नहीं है. सो टॉलरेंस भी ज्यादा है और चीजें बेहतर भी ज्यादा हो जाती हैं. जिथे होन जहालतां बगले लान अदालतां कां पे करम वकालतां सब नूं मिलन जलालतां दिल दा शीशा साफ नहीं रहिंदा उत्थे फिर इंसाफ नहीं रहिंदा. Unfortunately this is true, but again I don't know कहाँ मैंने देखा और मैंने यहाँ पे डाल दिया. यहाँ रेलेवेंस कोई नहीं थी उसकी. डेथ ऑफ वंस पार्टनर. जब आप किसी शख्स के साथ जिंदगी के 20, 25, 30 साल गुजार लेते हैं और उनमें से एक की डेथ हो जाती है तो दूसरा पार्टनर के ऊपर क्या रिएक्शंस होते हैं. डेथ ऑफ अ स्पाउस इज लाइकली टू एंड अ रिलेशनशिप दैट इज लॉन्ग एंड वेरी क्लोज. ये अजीब सा रिश्ता है मैरिज. इसमें एक पतला धागे से दो शख्स अटैच्ड होते हैं. 3 लव्स तलाक 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 एंड द रिलेशनशिप is gone permanently. And with this bonding that you share everything in marriage, money, your body, your emotions, your everything, you share everything. So it's such a strong relationship of a husband and wife, but it is just connected with a very thin tiny piece of a thread. So इस strong bonding और relationship में जब आप कुछ साल गुजार लेते हैं तो उसके बाद अगर कुछ हो जाता है आपके पार्टनर को, then the reactions are quite intense. The support system for the bereaved spouse is very important. The duration and outcome of the grief is important, and loss of a spouse leaves a positive bias for the memory of the relationship with the deceased. So वो चली गई या चला गया, वो मेरे साथ ये करता था, वो मेरे साथ कैसे बैठता था, वो मुझे कहाँ लेकर जाता था, हम खाना कहाँ खाते थे, हम बातें कहाँ करते थे. They are all good things actually, to be very honest. They are not bad things. They are good things because you try to recall the positive things in your life. Well, you do remember the negative things as well, but I always tell it to my trainees जिनको मैं सिखा रहा हूँ कि अपनी अच्छी मेमोरीज बनाएं. ठीक है, अच्छी मेमोरीज आपके मुस्तकबिल में आपके काम आएंगी. सो एंजॉय करना, जैसे दोस्तों के साथ बैठ गए, गप्पें लगाई, खाना किसी अच्छी जगह खा लिया, किसी को मिलने चले गए, बहुत अरसे के बाद किसी से मुलाकात हुई, उसके साथ खुल के बातें की. सो अच्छी मेमोरीज आपको फ्यूचर में और आपकी पर्सनालिटी पे अच्छा इम्पैक्ट लेकर आती हैं. तो जब हम बुरी मेमोरीज को अपनी जिंदगी का हिस्सा बना लेते हैं तो हमारा ओवरऑल पर्सनालिटी भी खराब हो जाती है और उस पर इम्पैक्ट पड़ता है. ओके, सो सॉरी आई एम स्टक. ओके, डेथ ऑफ अ पार्टनर और अ स्पाउस. कम ऑन, रियल स्टक? डोंट डू दैट टू मी. Oh, why it's stuck? Sorry. Let me see if I can move it forward. Oh, this was the last slide. So that is a different situation as well. So overall, in nutshell, what I have to say to you is that The grieving process is complex, it's complicated, it's unfortunately very tricky. And when you, as a psychiatrist, are seeing the patient, try to understand not only that this person is having a grief reaction, you have to understand the whole of the dynamics of that person. बहन भाई कितने हैं, माँ बाप कैसे हैं, घर के हालात कैसे हैं, फाइनेंशियल हालात कैसे हैं, आगे कौन है, पीछे कौन है, डिपेंडेंसी क्या है, पर्सनालिटी कैसी है, सपोर्ट सिस्टम कैसा है. You have to understand. Or age matters the most. So if a child loses someone, all you have to do is to make sure that the people around him, you have to tell them that they should support the child and he'll be okay. The person who is in 50s and 60s, if he comes to you for a grief again process or some symptoms related to grief, all you have to do is to just talk to them, do some grief work, and things are relatively better. But the tricky portion is the adolescents and the middle age. And those people have more devastating reactions to the grief. And if the grief is abnormal, so abnormal grief presentation is a complicated form, then of course the treatment and intervention also gets complicated. So that is the situation. कोई सवाल पूछना है तो पूछ लें, मैं फिर कुछ बातें और कर लूं. Anybody, any question?
एबनॉर्मल ग्रीफ जो होता है मतलब आप हमें ये भी बताएं कि जो फार्माकोलॉजिकल इंटरवेंशंस हैं वो आपने कब देनी है, स्पेशली जो मिडिल एडल्टहुड की आपने बात की. उसमें मेरा एक क्वेश्चन है, जैसे एक ओपीडी में पेशेंट आया था, उस 2 साल पहले उसकी वाइफ और उसकी बेटी की डेथ हुई थी स्पेन में. ही वाज रनिंग सम बिजनेस ओवर देयर और फिर उनकी डेथ हो गई इन ट्रैफिक एक्सीडेंट, और फिर वो वहां से सब कुछ रैप करके वो पाकिस्तान आ गया. ही वाज अराउंड 45 से 50 के दरमियान था वो. तो लेकिन वो यही बार बार उसका ही वो जिक्र करता था. डिप्रेसिव कॉग्निशंस मुझे लगी उस पे मतलब हिस्ट्री पे, लेकिन जो मेन जो पॉइंट था वो उसी पॉइंट पे स्टक था. और ऑन एंड ऑफ उसने ट्रीटमेंट भी लिए थे उसके लिए. पहले कुछ पास में वो एसएसआरआई ले चुका था, बेंजोडाइजेपिन डिपेंडेंस भी थी. तो फिर अगर ऐसा केस हो तो हमें इसे कैसे डील करना चाहिए, इस पे प्लीज थोड़ा सा बताएं.
Good. Okay. So, two things that I want to say before I proceed furthermore. One, I know that you are a very intelligent person and you are a wonderful person in seeing the patients as well. So even when you are talking in an activity like this one, when you are referring to a patient, always say "aap" ya "unko" ya "unhe." So that respect should not
Okay.
go away. Even when we
Yeah.
are sitting in a casual environment like this one, where there is no patient around, even then we should try to use those words. So उसका ख्याल रखो, आदत का हिस्सा बनाओ, इम्तिहान में काम आएगी. ठीक है, सो वो आदत के इम्तिहान में काम आएगी. क्योंकि जब हम कैजुअली इस तरह डिस्कस कर रहे होते हैं तो हम यूजुअली पेशेंट्स को रेफर कर देते हैं कि उसने ये किया. डोंट से दिस, बिकॉज वो हमारी आदत ख़राब होगी और फिर इम्तिहान में हम तंग पड़ेंगे. वहाँ पे भी हमारे मुंह से इस किस्म के अल्फाज निकलेंगे और एग्जामिनर आपको उड़ा देगा. सो वो यूज़ करें. सेकेंड, जो सिचुएशन आपने बताई उसमें आपने खुद ही उसका आंसर दे दिया. ठीक है, सो मैं उसी को कोट करूंगा, विच वॉज एब्सोल्युटली अ जस्टिफाइड थिंग. वन, बेंजोडाइजेपिन डिपेंडेंस. ग्रीविंग प्रोसेस में बेंजोडाइजेपिन्स, मैंने पिछली दफा भी बात की थी, आर कॉन्ट्रा इंडिकेटेड. समबडी आस्क्ड मी अ क्वेश्चन एंड आई ऑलवेज रेफर्ड इट दैट बेंजोडाइजेपिन्स आर कॉन्ट्रा इंडिकेटेड. व्हाई they are contraindicated? Because benzodiazepines unfortunately have an impact on our cognitions, and when the cognitions are impacted, our emotional behavior related to the grief gets compromised, and it's a negative situation and things do get complicated. So don't give benzodiazepine to a grieving person. So if he was given a benzodiazepine, the first target is to get rid of the benzodiazepine. So taper off the benzodiazepine, do something that he will be off the benzodiazepine, the first one. And you have mentioned it rightly yourself कि जो benzodiazepine dependency मतलब ये कि मुझे उसका कुछ करना है. Second, you have answered your question again yourself that there were some depressive symptoms. So abnormal grief can, yes, as I mentioned in my presentation as well, that if somebody has a grief reaction secondary to a traumatic situation, so the wife and the daughter died in an accident, which was a traumatic event, then the grief is more complex, more complicated, and you have to have more inputs to do more of the grief work than the usual thing. सो वो साइकोलॉजिकल ग्रीफ प्रोसेस जो है मैं उसको अभी नहीं छेड़ूंगा, वो एक अपनी एक अलहदा से डोमेन है और इट्स अ वेरी बिग टॉपिक एंड इट्स अ वेरी इंटरेस्टिंग टॉपिक, बट आई विल डेफिनेटली want all of you to make sure that you read about the psychological interventions in grief, because that is an important area that should be covered in the exam as well, or otherwise clinical setting maybe. So depressive symptoms the various SSRIs were tried, right? Now, if I get this kind of a patient, the first thing I will do is that I will see which SSRIs were tried and in how much dosage it was tried. So if he received, say, sertraline 100 milligrams or paroxetine 40 milligrams or fluoxetine 20 to 40 milligrams, I won't say it was an SSRI tried in a therapeutic dosage for a significant period of time. For me, fluoxetine, if I gave it to a grieving person, I will go 20, 40, 60, and if needed, 80 milligrams per day. That is the therapeutic range of fluoxetine. And if in 6 weeks time period, 80 milligrams of fluoxetine was not able to correct the symptoms, then it's a treatment failure, जो मैंने पहले अभी अपनी कई प्रेजेंटेशन में बात की है, और फिर मैं उसको टीआरडी या ट्रीटमेंट रेजिस्टेंट डिप्रेशन के जुमरे में लाके और ट्रीटमेंट स्ट्रैटेजीज ऑप्ट करूंगा. सो आप उसकी ट्रीटमेंट रिव्यू करें, एसएसआरआईज कौन सी दी गए, किस डोजेज में दिए गए, और अगर एसएसआरआई से रिस्पॉन्स नहीं आया तो उसको चेंज करके एसएनआरआई पे ले जाएं, लेकिन प्लीज डू गिव an appropriate therapeutic dosage of the medication. So don't give the therapeutic level. So 5 milligram escitalopram, 25 milligrams sertraline is nothing. It will do nothing, right? If you have to try a sertraline, I say always and always in my presentations, everywhere, wherever I do my presentation, that giving an appropriate dosage of the drug is important. If I give sertraline, I push it up from 50 to 100 to 150 to 200. So 150 to 200 or 100 to 200, I will feel that yes, okay, fine, this is the therapeutic dosage of sertraline. And if the patient is not responding, I will go up to 300, sometimes beyond that as well. The therapeutic range of sertraline की डिवाइस की गई. अगर उससे पहले कम डोजेज में दिया, रेजिस्टेंस डेवलप हो जाएगी, क्रॉनिसिटी डेवलप हो जाएगी, और साइकियाट्रिक मॉर्बिडिटी में क्रॉनिसिटी इज अ बिग चैलेंज, because then you are stuck and then you have to utilize more resources and then you are not able to do things the way they should be done. So please try to give the appropriate therapeutic dosage. Now, abnormal grief, because he sold everything there, business, wrapped up everything, came back to Pakistan with the hope that he will be relieved because he will be with people who are known to him. But actually, it never happened. So he kept on suffering because of that loss. इससे ज्यादा मजलूम आदमी और क्या होगा कि जो अपनी जिंदगी का सारा सरमाया खोकर भी उदास और मायूस और परेशान है, लेकर भी आके. So what I will do is that I will give him appropriate therapeutic dosage of the antidepressant medication, get rid of the benzodiazepines, and treat him on the lines of TRD, treatment resistant depression, if it is like that. So as I mentioned in the beginning, going back to the same thing, grief is very complicated. There was an article published by Pekel on grief, जिसकी मेरे उस्ताद लोग भी बहुत रेफरेंस देते हैं. वो आर्टिकल हिस्टोरिकली बहुत सिग्निफिकेंट और इम्पॉर्टेंट है, एग्जामिनेशन पॉइंट ऑफ व्यू से भी इम्पॉर्टेंट है. उसमें उसने ये कहा कि ग्रीफ हर साइकियाट्रिक मोबिलिटी के तौर पे प्रेजेंट हो सकता है. सो ग्रीफ में आप एंक्शियस हो सकते हैं, ग्रीफ में आपको जीएडी हो सकती है, पैनिक हो सकती है, एमडीडी हो सकता है, बाइपोलर डिसऑर्डर हो सकता है, स्किज़ोफ्रेनिया और साइकोटिक सिम्टम्स भी हो सकते हैं. So abnormal grief is, or pathological grief or extended grief can take the shape of any major psychiatric morbidity. और जब आप उनको देखते हैं ऐसे लोगों को जो 5 साल पहले जिनकी फैमिली में इस तरह का वाकया हुआ कि वाइफ भी मर गई, बेटी भी मर गई, कारोबार बंद कर दिया, डिपेट के पाकिस्तान आ गया, इसका मतलब ये कि चीजें क्रॉनिक हो गई. इसका मतलब ये कि चीजें बदल गई. वो ग्रीफ मॉडिफाई होके किसी और डिसऑर्डर में कन्वर्ट हो गया और वहां पे आपकी ट्रीटमेंट और मुश्किल हो गई. सो ग्रीफ वर्क जो था, जो बेसिक ग्रीफ वर्क था, उससे काम कहीं ज्यादा बढ़ गया. इसीलिए हम कहते हैं कि जी अर्लियर द ट्रीटमेंट द बेटर इज द प्रोग्नोसिस. बट अर्लियर ट्रीटमेंट मीन्स appropriate treatment on all three paradigms, all biological model, psychological model, and social model. The chronicity always comes when one of the paradigm is missing. I have given the medication, but I never did the psychological work. I have done the psychological work, but I haven't given the medication. And socially, I never tried to change the things. So things that do get complicated. And then outcome is not as we expect. Unfortunately, this is the dilemma again, that we are not able to provide all the things together. So if, as a psychiatrist, I can give him the medication, but I won't be able to give him the psychotherapy, which is a dilemma, which we should not do. And if we have supports of the psychologist, if we have the supports of the social workers, if we have the supports of the occupational therapist, then my job is much simpler. I will write the medication, the psychologist will do the psychological work for the grief, the social worker will take care of the social issues related to the grief, occupational therapist will try to do the activities of daily living in other associated areas, and patient will have a good prognosis and outcome. But if I am missing with that, then of course things are compromised. And when then things do get compromised, the prognosis is compromised. So outcome कैसे अच्छा हो सकता है? उस शख्स की जिंदगी तो फिर अजाब में ही गुजर जाएगी, जो कि एक अच्छा सिनेरियो नहीं है किसी भी साइकियाट्रिस्ट के लिए. सो मेरे पास पेशेंट अगर आए तो मैं एक ब्लो के तहत, एक फुल फोर्स के तहत, एक एनर्जी के साथ उसको ट्रीट करूं. अक्सर वो अगेन, you know me very well, Manur, so you know me how I treat my patients. So sometimes I'm very angry with them. I'm very angry with them. I'm furious with them, not with the hope that I want to scold them because I feel कि मैं उनके साथ ज्यादती करूं. No, मकसद ये होता है कि उनको अंडरस्टैंडिंग आए कि डॉक्टर की बात को सीरियसली लें, अपने फॉलो अप्स को रेगुलर करें, जो हेल्प कही जा रही है वो लें, ताकि आपकी क्वालिटी ऑफ लाइफ नॉर्मलाइजेशन फेज में आ जाए. So that is the thing. I hope I have given answer to your question.
सर थोड़ा कोपिंग
Yes, sir.
स्ट्रेटजीज के बारे में बता दें.